Doctor title not exclusive to medical professionals. Kerala High Court allows physiotherapists to use the doctor prefix. Now, this is in regards to something happened. I'll be a great journalist. Indian Medical Association was involved, and they had raised a concern about physiotherapists and occupational therapists and other people using the prefix doctor that they shouldn't be. But few hours back, the whole news got out that the High Court said it's not reserved for you guys. It's not said anywhere. So basically, doctors, physiotherapists, occupational therapists, all these people can use the title doctor. I was going through a bit of comments on Instagram. That is my primary news source. There was mixed opinions on the case. Like some of them were saying excellent, great, fantastic. This is what we want. Now even nurses should be called doctors. Yay! Whereas the other spectrum of people are saying, yeah, my driver should be called a doctor then. Now, before I move on with anything and before I make my point, I just want to clarify that I don't care. As far as I'm concerned, the title holds nothing. Everyone has specific roles they play, and each role has to be executed properly. Now, to execute those roles properly, you need adequate training. So, when you're trained to do a task, you do it as much as possible by you and make sure the work gets done. So, as far as I'm concerned, I don't care who's the doctor, who's the nurse. If you're trained to treat the patient, treat the patient. If you're trained to do certain tasks, if you're trained to do physiotherapy, do the physiotherapy. And that's all that matters. Because at the end of the day, what everyone wants is to do their job properly, make sure the patient goes home. When I saw this news for the first time, uh, a similar thing had happened in the US. I think it has been happening for a while now, but I had seen another reel where a doctor was explaining about the situation, so I looked it up. This is the article. It says nurses with doctorate in nursing practice (DNP) should not call themselves doctor in a clinical setting. Now, the argument they had was if everyone is being called a doctor, that creates confusion amongst the patients. So, a lot of people were against it, a lot of people were for it, and a lot of people thought, oh, so what? TNP should not be called doctors? Aren't they good enough? All that stuff. But at the end of the day, it showed in an academic setting, they could appropriately ask to be called doctor, but to call themselves doctor in a clinical setting misleads the patient and perpetrates a fraud which defies their patient's trust. Now, I think that is a very valid point because if everyone is being called a doctor, for example, a patient has a fracture, they come, they see the first doctor who's the orthopedician who's going to treat, then they meet the second doctor who's going to give them their meds, then there's going to be a third doctor who's going to decide if the drugs that they prescribe is good, and then the fourth doctor comes who does the physiotherapy.
2 hours later.
So there's like some 7 8 doctors coming and treating. So in such a setting, there it's so funny because everyone wants to be called a doctor. Now I don't know why everyone wants to be called a doctor. Maybe they wanted to be a doctor and they couldn't, or they feel like being called doctor is a great thing and there's a social status to it. If everyone is being called a doctor, everyone is happy, but that's not how the world works. You can't make everyone happy. What they said was it would be understood that a nursing practitioner is going to be giving the nursing care, whereas the doctor, the actual doctor, or the primary physician who treats the disease will specify their role. But why? Why does it matter? Who cares? Why does everyone want to be called a doctor? I don't know. So personally for me it doesn't matter. But for some people apparently it does, and I think it's pretty stupid. This was the thing that came out today. Doctor title not exclusive to medical professionals. Kerala High Court allows physiotherapists to use doctor prefix. So I think this is overall an absurd argument. And again, this is for me personally, I don't know how the other people feel, because as I said, there's a mixed opinion on this whole thing. It creates unnecessary confusion, and I don't think it should be a thing. Be proud in what you're doing, and just make sure that you do whatever you're doing properly. I cared for a young diabetic patient who did not know if he was type 1 or type 2 diabetic. He has an obvious cutaneous yeast infection with groin fold. His body mass index is 40. Typical daily awakening blood glucose was 250. Okay, he was unaware of his HbA1c levels. It's clear that they had DNP degree and made no written claim to be a physician. However, the patient said that DNP called herself his doctor during his office visits. The patient told me he did not understand the difference between a physician and DNP, so I explained the difference to him. He reported that his DNP had never suggested referring him to an endocrinologist or adding any other medication to his once daily insulin blood sugar regimen. Further, she had never suggested the weight loss would benefit him. Everyone has their own rules. If you are trained to be a doctor where you will be treating the underlying condition, whether diabetes, fractures, whatever, you will be trained to do so. So if they give an opinion, the patient will believe that is their doctor, because how do they know who's their doctor and who isn't? I think this case sums up the problem. If you're not qualified to do something, then the chances of you knowing what to do is going to be slim. So if everyone is called a doctor, that creates unnecessary confusion. I found it interesting because a lot of people, especially in the Indian context, want to be called doctors. A lot of people become doctors because of the social status, believe it or not. A lot of people become doctors so that they get married. A lot of people become doctors and they flaunt it so hard that their entire personality trait revolves around them being a doctor. So it's pretty interesting how the human psychology works, and this is nothing short of it.